Okay, thank you for inviting me to have a chat with you with regards to mental health well-being for higher education. So my name is Cregan, as you probably already know, and I'm going to have a chat with you about say that how we developed the mental health first aid in higher education, why it came about in the first place, and really where it is now and where it's going. So why we introduced it? Well, we know that health, well-being, productivity is all linked to us being able to be resilient. And if we look at the stress management standards, we can see that demands, control, support, relationships, role, and change are all part of ensuring that we have a sustainable sort of physical and mental well-being. And why mental health in regards to higher education, really? Higher education, we've got 162 higher education institutions, 2.5 million students, approximately 400,000 employees. So, we're doing an awful lot, dealing with an awful lot of people. So we do prepare our students for the world of work, but, we also need to consider our employees and ensuring that they've got the resources and the capabilities to deal with the challenges that come our way on a day-to-day basis. And if we look at that, employees, let's have a look at the statistics. Employees' health accounted for 20.7 days lost for employees in 2014-15, which is an increase from the previous year. In the comparison with the wider economy, working days lost associated with stress accounted for 43%. And that was from the EAUC-S absence management report for 2015. Also with students, mental health and social communicative impairments such as autism have doubled since 2008-9. This has impacted quite significantly on institutional services and support structures. And we're asking our employees to deal with really some complicated issues, and having experienced some of those, being able to signpost and guide individuals to the right resources is increasingly important. I think the challenge for this environment was that people haven't got time. We know that there was mental health. There's lots of different courses out there, and there's a mental health first aid course, particularly for sort of not champions, but first aiders, I should say. And that was a 2-day course. And what we were finding was that employers and employees were reluctant to spend 2 days out. They knew it was an important topic, but for this sector, it just, with all the work that everybody's having to do, with the challenges of resources being sort of reduced and more for less, the pressures were just too much for people to take time out. And so part of the work that was done was working with what we call regional engagement and wellbeing networks within the sector to identify what we could do to support these challenges in terms of providing mental health training with the challenging resources that we have. And we came up with, we worked with Mental Health First Aid. They came along to one of the Northwest meetings, and Mental Health First Aid worked with us to identify a 1-day course that could be developed and rolled out across the sector, and with particularly focusing on higher education. I think what we've got to realise is that we had a generalist course. There was mental health first aid across the board. We've not necessarily, although Student Minds has done a few things, we've not necessarily had anything which is purely higher education based. And with the nuances that we have to deal with on a day-to-day basis, it was really important that that was taken into consideration when developing the course. So the regional networks, particularly here at Chester, worked with the mental health first aid directors to develop a course specifically aimed at higher education, 1-day course for staff and students. So that was developed in September, October 2015, and then it was rolled out as an actual pilot in January 2016, and that ran from sort of January to March. It was really positive response to getting that that course sort of out there. I mean, the one-day course covered key areas such as understanding mental health, anxiety, depression, suicide, self-harm, and eating disorders. And the aim of the study was to see whether a mental health first aid course designed for higher education could improve knowledge and confidence for specific use within the university sector. It was also to identify whether it was beneficial for improving the knowledge base and confidence of participants in relation to a variety of mental health issues. So what we did was we worked with MHFA to recruit 16 pre and post 92 institutions to take part in this research project. All of the participants are study were either staff or students of the host institutions, and they self-selected themselves, and there was no other restrictions imposed, e.g. whether they were an academic or professional or what have you. So there was a pre-survey done at the beginning, and that was to identify confidence levels around mental health. The same survey was done again at the end to see whether or not confidence levels had improved, and that individuals felt that they could signpost individuals and that they had enough information to be able to deal with those day-to-day issues that they're faced with, whether it be a professional support member of staff who's dealing with a student, or whether it's an academic through a personal academic tutor system, or in a lesson and something happens. So the questionnaire was actually based on the EY, it was the section E of the WISE project, Wellbeing in Secondary Education Staff Questionnaire. So it was an established questionnaire. It wasn't something that was done new. It was essentially taken and modified to support this particular project. So as I say, we had in total, we had 190 individuals participate in the actual project and complete the survey. And what we found was the number of respondents before and after intervention, in terms of how confident they felt helping a colleague who appeared stressed or down, had moved significantly from a little bit, which was before the intervention, to quite a bit after the intervention. So there were some significant results coming from actually undertaking the training. The number of respondents on a scale of 1 to 10 who had personal confidence of how best to signpost others with a mental health problem, that rose really from going from 1 to 10. Number of respondents 4. There was about sort of 30 odd respondents, in the 4 or 5 range, and that rose to 60 respondents in the 8. 55 respondents in the 9, and then another sort of 30 odd in the 10 after the intervention, after the training had taken place. So overall, the actual training itself was seen as a positive. So MHFA then took this and they made some modifications to the course, so that we took into consideration the evaluation results, and we were able to, excuse me, they took into consideration the evaluation results, and they developed the course materials, and were able to roll out this course from early in 2017. It's been absolutely amazing. The response from other institutions that want to take the course, the responses, the sort of participation really between universities in helping each other out to sort of, use their own trainers to train on the course. And the response in terms of signposting individuals and people having the confidence has rocketed really from having this one-day course. I think the one-day course has definitely been a benefit, because one of the outcomes of the course is that you get champions in your university. So rather than, you can still do the 2-day first aid, mental health first aid one, but the one-day one gives the opportunity for people to become champions. And that's quite a nice badge and a nice thing to sort of roll out across the board and develop a culture of mental health well-being within the organisation. And I think, what it's doing is, we're talking about sustaining positive mental health, sustaining, healthy working lives. I think what's coming out here is it's about communication. And if people get the opportunity to know that there are people there that can signpost them, guide them, then socially that's going to be better for all. So yeah, it's going from strength to strength. We continue to look at ways in which it can be evaluated, and my understanding is that the mental health first aid course generally across the board is going to be evaluated by MHFA on a much more wider scale, and that's something that we are supporting over the coming months. So I'm more than happy to answer questions that people may have, signpost myself to individuals who may be able to help if you want to get this course running for your own organisation. I'm going to send you some slides that you can have a look at as well. So yeah, I'm happy to sort of talk further and have future discussions on this. And I'd just say good luck with your strategy. But the one thing I would say is, it's about developing a culture of positive mental health, and that's what this course was intended to do, and that's what it is doing. It's enabling lots of individuals to take part in something which is cost effective, which is providing enough information without it being clinical, to give people confidence and showcase that actually as an institution we care about our people and our community. So thank you very much.